Hi everyone. Today we're joined by Travis Mickelson, our Medical Director of Mental Health Integration, talking about managing depression and preventing suicide. Travis, thank you so much for joining us.
You're welcome.
Our children and teenagers are being asked to step away from social situations and major milestones in their life, like sporting events, graduations, and even more. And this could be contributing to the stress and anxiety that they're potentially feeling right now. What advice would you give to teenagers and parents for supporting each other in this tough time?
Well, hearts are breaking everywhere for this fear and uncertainty that we have and what we're not able to participate in. And I just really feel so sad for all those kids and teenagers who are missing out on their sporting events and worrying about things like, am I going to miss graduation, and not being able to spend time with their friends, especially teenagers who are they're actually wired to want to be out of the house, away from us parents, hanging out with their friends, learning how to be independent. And so it's very difficult for what we're asking them to do. So first off, I want to thank those teenagers for thinking about what's best for our community and our society by distancing, so that we are really helping to prevent the spread of this virus. But because this is a very real thing, I want teenagers to know that they need to take time during their day to really express how they're feeling about this. One of the things that we talk about that can lead to concerns like depression is our thoughts can sometimes be very negative in their nature, and sometimes a bad situation can make us think that everything in our world is bad. And oftentimes when we're dealing with stress, our mind even doesn't focus so much on those things around us that are going well, and we start to think and almost catastrophize that everything in our life is not going well. Those thoughts can really have an impact on our emotions, can make us feel sad, hopeless, angry, irritable. And those emotions can affect how we act. And some of us are going to be more irritable and getting arguments with our parents. Others of us are going to want to isolate into our room. And then those actions can then again feed back in on our thoughts. And so I think one of the things that's important for teenagers and parents to know right now is we need to support each other in giving us an opportunity to communicate how we're feeling and what thoughts we're having. And at the same time, a way that we can help to prevent symptoms of depression and make us feel stronger and more resilient is to pay attention to how we're acting and make sure we continue to do the things that we know are positive and helpful and will make us stronger and more resilient.
Yeah, I'm sure the reflection of how a parent is feeling could go on to a child or teenager, so making sure you're aware of what you're doing is probably important as well.
You're right. Yeah, you're right.
Yeah, so if a parent is concerned about depression in their child or a family member, what is something they could do?
So one of the things that we want to show you is what's called a patient health questionnaire. And this is the world's gold standard in how we think about and screen for depression. And on this, you'll see 9 questions. And those first 2 questions are very important because that asks about, are you feeling down, depressed, and hopeless? And are you not enjoying things that you usually enjoy? And those are the 2 main symptoms of depression. One of the things I want our listeners to be aware of is it's much more common for children and adolescents to express depression with an irritable mood rather than a sad mood. What you'll also see in these 9 questions are other signs that go along with depression, such as appetite changes, sleep changes, energy changes, concentration changes. And that very last question, that 9th question asks, are you having thoughts about wishing that you were dead or having thoughts about wanting to hurt yourself in any way? One of the biggest concerns we have for depression is that depression leads to self-harm and suicidal thoughts and behavior. Suicide is the #1 cause of death for our adolescent population in the state. And so that PHQ questionnaire is something that every teenager, every parent can put on into their Google search pull that scale up, and they could use that scale to help them have that conversation and get a sense of how concerned they might be. If you were to look at that PHQ-9 questionnaire, after those 9 questions, it then asks, how difficult have these symptoms been for you? And this is important because obviously in a time like this, we're going to have some signs and symptoms of depression that might be considered normal. But if we're experiencing these symptoms nearly every day for more than 2 weeks, and if these symptoms are causing a significant impact in our life socially, at home, academically, then that helps us as parents know whether we need to be concerned and what our next steps would be.
That's some really great advice, and it was really easy to find on Google, so if parents are interested in finding it, you can just Google PHQ-9 and it'll pop up right there for you. So people are also being told to stay at home if possible. How are they supposed to have an appointment with their primary care physician, their pediatrician, a psychologist, or a therapist? What are some things that people can do to still reach those resources?
I'm so glad you brought that up, because one of the big messages that we want our community to know are that your primary care doctor, that person who you know and trust best, who knows you and your family's health and has been with you since the birth of your child, those primary care doctors are still in clinic working. And they are very well trained and have the skills and the resources to really help in a time like this. And if you were to contact your primary care doctor's clinic or your therapist clinic or psychiatrist clinic, they're going to be able to schedule a video visit where you can actually, through either your smartphone or an iPad, a tablet, a computer, be able to have a video conversation and visit with your provider, and they're going to be able to help you create the plan to how best support you. So even though we are asking you to stay at home, your healthcare providers are able to reach out to you while you're at home through these resources.
Those are definitely some great resources, especially during this time. So what is one thing that parents can do to help prevent suicide?
So one of the things I want to make sure that we know about suicide, first off, is the most common way people kill themselves is by using firearms, and that's both handguns and rifles. And the most common way people attempt to harm themselves or kill themselves is by overdosing on medications. So as a parent, I want you to focus on 2 things: supervision and access. Fortunately, in a time like this, you might feel like you have more time and actually more ability to supervise your children and teenagers since they're not allowed to leave. Access refers to what can you do to decrease access to things that could be lethal or things that could be harmful. Focus on safety. So in a time like this, if your family has access to firearms, like many families in our community do, think about, is there anything that could be done to help increase the time between your teenager having a thought of wanting to kill themselves and having access to a lethal means like firearms or medications? So if your firearms aren't locked up, please do that. And there are also some great community resources out there. For example, the Safe Harbor Law is something that is available where our local police departments can store our firearms securely during this time that we're concerned about safety. So this is one area where, whether you are an owner of firearms or not, we can all focus on that common goal of keeping ourselves and our family safe.
That's great advice. Thank you so much for talking with us today. If you're looking to speak with someone about depression or preventing suicide, there are many resources out there that you can call. There's a National Suicide Prevention Lifeline that you can call at 1-800-273-8255, or you can call the UNI Crisis Line and Mobile Outreach Team at 801-587-3000. There's also a Safe Utah app that you can download on your mobile device via Apple or Google. And speak with someone that way as well. Again, if you're interested in talking to a healthcare professional about concerns related specifically to COVID-19, You can call our COVID-19 hotline at 844-442-5224. Thanks, everyone.